And now we're going to head to Burkina Faso. One child in 10 dies before the age of 5 because of preventable infections like malnutrition, diarrhea, pulmonary infection or lung infections or malaria. And so in connection with the health ministry, an NGO named Terre des Hommes launched an e-diagnosis named IeDA. And for us to understand this diagnosis approach, Sonia Anselin Panzani from the NGO Terre des Hommes is going to come on stage. She operates from Dakar. She's in charge of a wide part of West Africa, and she's the one who's going to receive the award. Well, you can have a seat. We're going to discuss the app, an application which is not on a smartphone, but rather on a tablet. But it's a smartphone for first-line healthcare professionals, those people who work in the field and help manage children. So how does this app work? Does it work on a tablet? Is it on any kind of tablet? Well, as a matter of fact, it's operated on a pretty typical tablet, without citing a brand that is a Samsung tablet. So we have fitted a number of solar panels to first-line community centers, and we provide them with connection devices for them to send the data on our servers. So the tablets are fitted with solar panels, and this application is going to be used in areas that are pretty remote from the capital city. Yeah, that's right. We operate in a number of areas which are pretty difficult to reach, which are sometimes not very safe, unfortunately, and we cover 40% of the first-line centers in Burkina Faso. By 2020, end of 2020, we will have covered 22% of all the centers in Burkina Faso, so this is definitely a source of joy and pride. So this is an application which really targets infants or children aged from 1 to 5. The mortality rate is very high, as I said before. And you said that it was a priority for you to help and train people who work in the grassroots level when they receive those children and their mothers. And so I do have in mind this example that you cited. When you get a child and you hear, well, my child has painful ears, you should not only look at the ears and have a more comprehensive approach. This may sound as a given, but not necessarily for all the healthcare professionals in the field. Therefore, you have a questionnaire that is going to help direct the consultation. Well, yes, this is what we did. We have an integrated management of childhood illnesses protocol. This is a WHO algorithm, which already exists. And it's going to start with very typical questions to try and detect signals or signs to have a more comprehensive management, again, in the presence of a child aged less than 5. So for us to have a better understanding how it works, we have a small short video with a protocol. So if you could please show us the video. This is a question to the tech. Thank you. So this is video for us to have a better understanding. So can you please describe how it works? Well, first and foremost, you click on the consultation, child consultation, and first we try to see whether this child has been consulted or has consulted already. This is very nice because you can access the history of consultation. So you hook up to the server, you synchronize the files, and then the healthcare professional can enter their PIN code. Each healthcare professional has a PIN code to be sure who typed in which piece of information in the record. Then we start with vital signs, then the height and weight, the brachial perimeter, the blood pressure, and then based on that we get a score on the nutritional status of a child, and then we ask a number of questions. What's the reference, why and how the child came as a consultation? You do see that the application already says that that child, this is a child at risk. So we do register a number of signs or symptoms that may be a sign of danger. There are a number of variables, and you need to answer all those questions to be able to register the entire consultation. Now, as soon as there's a sign of severity, then the healthcare professional is going to receive a message. You do see a number of pop-up windows and messages. You see the arrow on edema, and so the healthcare professional is instructed how to look for edema, and is going to instruct the healthcare professional how to better locate the edema. So you have pop-up windows with videos and instructions to help with the further consultation. And we go as far as treatment and prescription after we've made the diagnosis. Now, the healthcare professional must also explain whether the indicated or prescribed a drug different from the one suggested by the application. And if they prescribe something different from the app, they may explain why. Because, for instance, there's an out-of-stock situation on a given molecule. Now, this is a case of malnutrition, and so you see a number of advice for this child. Apparently, this child has a problem of malnutrition. Now, in this app, to use it, do you need a number of prerequisites, medical prerequisites, or can anybody, as it were, use this questionnaire? Because it seems that the questions are pretty straightforward. Well, the tool is not going to replace the skills of a trained healthcare professional, and that's a good thing, because in this protocol, you need to have some sound medical knowledge. However, this protocol was initially designed for nurses, but we also have healthcare professionals with a lower training also using it. So it's a real aid, it's a real support. Of course, you need to have a medical background to be able to observe the science properly. We can see that culturally things are changing. Now that healthcare workers, they start using the tablet, and you do see that mothers do not have the same outlook on the conversation. Well, in the first time, we were pretty concerned because we thought, well, we're going to have a tablet in between the mother and the health worker, and maybe it's going to create a gap, it's going to create an extra layer complexity. But we do see, and we've had 3 studies by the London School of Anthropological Medicine, which does demonstrate that there's a good onboarding by the mothers. In the rare cases, when the tablets are set aside on the desk, mothers are asking for the tablet to be used because they feel reassured. They do see on the screen that all the questions have been asked systematically, and for them it's definitely a sign of quality. Now, for the health worker, was it also a source of reassurance, or were they frustrated, or did they feel that their powers were removed from them? Well, in the beginning, the health workers thought that it would be an extra workload, and they thought, well, maybe are we going to get a financial incentive? Are we going to be financially compensated for that? And we said, no. All projects we do, it's not only for the NGO design. We also do that because then we want to have a sustainable and long-lasting operation that is then handed over to the ministry. So we wanted to have something that could then be operated by the ministry. Now, what we based our project upon were the needs of the users and the needs of the health workers. And again, we're not only compiling information or harvesting data, but we're really helping in decision making. And they could see, and that's also feedback that they're providing, it does help with their daily work. And therefore, they like it very much. They like very much to be able to see the entire history of a given patient. Yes, also what is important in this application are the videos. There are a number of videos, and it's not only the playful dimension, it's also to help in dissemination of knowledge. Well, that's right. And this project, namely IeDA, has 4 components. First and foremost, you have a history of consultations, but also we can manage a number of data, some of which are very paramount. And so we're going to use this data in a number of health centers. They have health centers where they have more issues in the management of children. So we're really going to focus training of the centers with issues. We also provide coaching for our health workers. And again, this will be a one-on-one training, and we'll try to see the problems they have in analyzing some symptoms of signs. And we're really going to customize the training of a health worker thanks to that module. And then we have a module named e-learning with a wealth of videos for the health workers, again, based on the mistakes that they make. So it's really a virtuous circle. It's like a loop, and there's it's being incremented with the data that we have going forward. So now the version is the 2.7 version, and every time we have a feedback of our users, we do improve the application accordingly. Today, what do you do with the data that being harvested? Can you use them? Can the government from Burkina Faso use them in order to design the policy, the health policies? Can they be used for technical purposes? What do you do with those data? Answer. We have different ways to manage or use those data. We have different dashboards for the different levels of the healthcare professionals. So, as the previous speaker said, according to the needs in health data, we have different dashboards. And so we're not going to provide too many information to those who do not need them. So we have a very customized system. So the nurse in charge of the health center needs to know the performance level of different workers. And also he or she wants to benchmark compared with the other centers. So we're going to set up the dashboards. And also sometimes you need to drill down on some data. You have to know that we have more 200 consultations per month, and we have a number of partners. We have recently started a dialogue with the WHO to see if we can improve our epidemiology of malaria in Burkina Faso. This in collaboration with PNP, because the WHO thinks that the database that we have is a sound database with reliable information, and this can be an asset for the design of the health policy. All right, so this is one of the keys to success, because you have so many children who consult, and it's again a good basis for a partnership. So you mentioned the WHO plus the Bill Gates Foundation. So who are your other partners? Answer. The first partnership we have is with the Health Ministry. It was a co-design or a co-creation process with a medical doctor from the Ministry of Health. And they wanted to improve the individual follow-up of patients. And they wanted to be sure that there was no confusion in the number of consultations and the quality of care. So this was a co-designed application, and I think it's one of the keys to the success of this application. So this is the third partnership, Ministry of Health. This year we started the transfer of this application to the Ministry of Health. It's going to last for 24 months. There are a number of milestones, but eventually the ministry will have access to this data in Burkina Faso, and they will have technicians who will be in charge of managing the database with an extra layer of safety. So this is the third partnership. But beyond that, IeDA is definitely based on partners and partnerships. Since 2014, we are financed or funded by the Bill and Melinda Gates Foundation. So we were supported by them for the technical point of view. Dimagi were also a partner because they have a very robust platform based in India. They have 240,000 users in India, and so they're good for making a connection with DHS2 because our platform is connected to that. Now, when it comes to coaching, we worked with QRC, and we continue to strike partnership. We have a very recent partnership with the University of Geneva to work on big data and AI. So this is something which, of course, is a source of enthusiasm. We want to go even further, work on a smart dashboard, predictive models, and this is definitely something which is quite exciting. And I'm probably forgetting some of my partners because we have so many. We also have an alliance with World Vision and Action contre la faim. We want to go even further on digitization and to have a better management of malnutrition. Now, what's the future for this application? Are we going to continue and focus on 0 to 5 children? Or are you going to become maybe more international, or maybe broaden the population which is being covered? Well, on the map, you do see what we want to do moving forward. So in orange, this is the current scope, 40% of the territory, but we want to reach no less than 62% with the rest of the areas in blue. Now, you do see in those small icons, those are the developments of the protocol. Last year, we started to use a questionnaire in 3 areas on the surveillance of malaria. We also started to apply the e-Ange on malnutrition and nutrition in infants performance. We also input a number of indicators or KPIs of CHS2, and we also have a number of follow-up consultation pre and post birth. So I think that the future of this application will definitely to widen the scope, add features, and be definitely extended to other protocols as well. Do you plan to extend that to other countries? And so yes, in 2016 in Mali, we started a pilot project with only 2 community centers, but this is going to be strengthened in the future. We're about to start in Niger as well, in the framework of a project named Connected Village, and we're very much anticipating that because we're going to have a number of interoperating an interconnected application. So we're working currently on interoperability because this is a key word since this morning. And beyond health, we will also have connected solutions for agricultural purposes, education, governance. So it's a major project, and we're very much we're quite excited about that project. As you said, it's important to scale up the scalability of a project, because the more data we have, the higher the performance of a project and the more benefits of a population. How could you illustrate the scalability of your application? Answer. In fact, as the Bill and Melinda Gates Foundation said, you need to make them addicted to data. And it does work. It's extremely successful. Every time we see a problem on a dashboard, we get people calling us, well, we have this issue. We need that piece of information. We need that data, especially on the program to fight against malaria. We are doing a preventive immunization against malaria, and we need to know after a dose has been injected, we need to know the result and prevalence. And so we have had a number of requests to add more KPIs. And so we're here to improve the data as we go. And AI, will it help improving forecasts on malaria or any other disease? Is the objective to build predictive models? Answers, well, yes. We do have a number of epidemiological data in the database, but we'd like to be able to cross this data with meteorological data or data based on market prices to have a predictive model. This is a project that we have with the Cloud Era Foundation in Geneva. Now, this award that you receive, what are your expectations? What do you think is it going to bring you? Well, we're very happy, and we'd like to thank the foundation for being recognized. Visibility is key, and recognition as well. The fact that we meet here and we are able to create connection with different countries in the sub-region, plus other suppliers and other vendors of digital solution, I think it's key. We've all said that we need to better work together, work more together, and of course I'm very much looking forward to have this facilitation, and it's definitely a plus for us. Thank you ever so much. Thank you very much, Sonia Anseli Panzani. She's the laureate for on behalf of Terre des Hommes.